We're going to move straight on to the next speaker, which is Pearse Keane, coming from Moorfields, about curation for Google's DeepMind partnership. I'm always reminded of the film 2001: A Space Odyssey when you say DeepMind. That title scares me.
Well, I think that they would probably be quite happy with that allusion. But you know, I'd like to thank the organisers for this. I think really you know, interesting and powerful event. And I really enjoyed Andrew's talk at the start, setting the context for this. And one of the things that it just occurred to me to comment was that, you know, there's a temptation to think that the grass is greener and to think that other countries are kind of leading the way in some of these things. And let me tell you, you know, I worked for many years in the US, in Los Angeles and elsewhere, and I've got lots of friends and collaborators in China. But I think there's no place that I'd rather be than the UK to explore health data research. And I think if we all kind of can find it in ourselves to row in the same direction, then I think we can be world leaders in this regard. So I like to think I'm, like Brian and others, I'm very much an optimist in this regard. So just to say to you, I'm an associate professor at UCL and a consultant at Moorfields. And in the interest of disclosure, I should tell you that I do act as a consultant for DeepMind as well. So why did I initiate a collaboration between DeepMind? What was the problem? What was the pressing, specific problem that we faced? Well, this is the problem. Some people think that ophthalmology is a small medical specialty. Particularly other medical specialties might think that ophthalmology is a niche medical specialty. But in 2017, ophthalmology overtook orthopedics as the #1 medical specialty across all of the NHS in terms of outpatient clinic appointments. Nearly 10% of all NHS clinic appointments are for eyes. And what's interesting is if you plot the changes in those numbers across the different specialties, ophthalmology is going like this. Now, as a result of that, we are drowning in the number of patients that we have to see and treat. And the simple fact is that there are many patients who are losing sight irreversibly because they cannot be seen and treated quickly enough. And I think if we knew the full scale of this problem, we would be horrified, because I think it's bigger even than we realize. And so what I initiated this collaboration with DeepMind because I felt that new technologies and innovation and potentially artificial intelligence could at least begin to help address this sort of problem that we face. So in July 2016, Moorfields formally announced the collaboration with DeepMind. And actually, that collaboration had started in 2015 when I contacted Mustafa Suleiman, one of the co-founders of DeepMind. And for a year or two before that, I had been trying to think about how I could get some links with either academic or industry experts in deep learning, in AI, to address the problem that we had with ophthalmology, with the huge number of patients. And so as it happened, I tried to contact many people, and Mustafa was the first people who kind of responded to my approach. So I said to him, look, I'm a consultant at Moorfields. We do more than 1,000 OCT scans, optical coherence tomography scans, per day at Moorfields. We're 2 stops away from you on the tube. People are losing sight because they cannot be seen and treated quickly enough. We should use deep learning to try and prioritize those people with sight-threatening disease. Now, to my excitement, he responded and he said, come and have a coffee and let's talk about this, back in the middle of 2015. So when I went to see him, you know, I was sort of full of enthusiasm, and he said, well, you do 1,000 OCT scans per day. How many do you have in total? And I had no clue. He said, how many are of patients with diabetes? No clue. What's the file format? Can we change this from a proprietary to an open source file format? What's the technical feasibility of this? No clue. What are the ethical, what are the governance considerations of this? You know, how do we share data from an NHS organization with a company like DeepMind? So actually, I went out of that meeting with a kind of long list of things that I had to begin to investigate, and it took a huge amount of teamwork within Moorfields and support from both higher and lower levels within the organization to begin to answer those questions. And let me tell you, we were tenacious in answering those questions, because most clinicians who are left to answer those questions would not be able to do that. Now, when we had answered all that questions, which took us 6 months to a year, it was at that point that we were able to, formalize the relationship in a research collaboration agreement that led to us sharing at that time about 1.2 million historical de-identified OCT scans of the retina to begin this collaboration. And let me tell you, even if we had no scientific output from that point onwards, that would have been an achievement in itself, because it's certainly challenging. Now, given the sensitivities around that, sharing NHS data, albeit anonymized historical data, with the company that is owned by Google and Alphabet and the like, we were very aware from the very start that we had to put patient and public engagement and transparency at the center of this. So even before we announced the collaboration, we've dedicated a portion of the Moorfields website to this. It's still there, you can check it out. It's got questions and answers. It has things such as, do patients have to give their consent? And if you want to opt out of the research, who do you contact to opt out of the research? And since 2016, we've had approximately 10 members of the public contact us to opt out of the research. Now, as it happens, none of those people have actually had an OCT scan done at Moorfields, and which, makes me smile a little bit, but at the same time, it's incumbent upon us to win the respect and the trust of people that we really try and bake these things into the process from the start. If you go to Moorfields, there's posters around which describe the clinical research we're doing. We have TVs in the waiting rooms with a screensaver, and at least one of the screensavers talks about the Moorfields DeepMind collaboration and gives contact details if you want to opt out. We also, before we did any science, we published what we intended to do in an open science journal, and then really fundamentally proud of the fact that we've made our research patient-centered from the very start. We've had engagement days. From the very first time we announced the collaboration, we had support from all the major eye disease charities, from the Royal College of Ophthalmologists, strong links with the American Academy of Ophthalmology in the US and others. And we've had support of brilliant patients like Elaine Manna. And Elaine is someone who, for me, exemplifies why we want to do this in one story. So Elaine has macular degeneration, the commonest cause of blindness in the UK. And Elaine lost her sight in her left eye more than 10 years ago, before there was any good treatment for wet AMD, the commonest cause of blindness. Now, in about 2012 or 2013, she started to develop visual loss in her good eye. She went to her local optician. Her optician said, "I think you're developing wet AMD in your good eye. You need to get an urgent referral to the NHS to be seen and treated, because now we have some treatments. We give you these injections into your eye and we can stop you from going blind with this." She got an urgent appointment, and when do you think that appointment was for? 6 weeks later. Now, imagine a situation where you're at home and you're losing sight in your good eye and you're told you have to wait 6 weeks. Because if that was a family member of mine, I would want them to be seen and treated within 6 days, not in 6 weeks. So, of course, the problem for us is that we have to figure out the systems to allow us to identify those people with the sight-threatening disease as soon as possible. And these new technological innovations may be, I think, one of the strongest ways to do that. So that was all before we did any of the science. And so it was exciting then in September 2018 when we published in Nature Medicine the first proof of concept of what we had done. And essentially what we showed in that retrospective proof of concept study was that we could train an AI system to look at these OCT scans and have a performance on par with world-leading ophthalmologists at Moorfields in diagnosing and triaging more than 50 different retinal diseases. So we're very proud of the work that we've done. However, it's still only in the early stages, and it's not actually been implemented for actual direct patient care yet. So just in my last 2 or 3 slides then, what are some thoughts that I have about the value back to Moorfields about this? And just sort of some of my kind of initial sort of musings about the value back. So the first thing is reputational. I think it's fair to say that we have received global media coverage from this collaboration, and Moorfields is already the oldest eye hospital in the world, by far the most famous eye hospital in the world. And I think that this is a way for us to maintain and sort of reinvent that reputation as the world's leading eye hospital for the 21st century, and being at the cutting edge of AI. Now, I think that's important because one of the things that I've seen is that I get a lot of people from all around the world contacting me, wanting to come to London and come to Moorfields. I have had 19 international research fellows in the last 3 years who have come from Canada, the USA, Brazil, Switzerland, Australia, Germany, Egypt, and a number of other countries, who have all brought their funding, their own funding, and have come to join my research group over the last few years. And let me tell you, there is some really exceptional people in that group. If you looked at their CVs, it would really kind of give you a case of imposter syndrome. And at least one of those is going to be a world leader. I can predict that. So we're getting the best talent wanting to come to work with us. Another aspect of our research collaboration agreement is that Moorfields has free use of the algorithm for research purposes, and if it is turned into a product, because it hasn't been yet, but if it is in the future, we will have free use of that for direct patient care. The other thing is that has led to a large amount of scientific output, relatively speaking. We have presented the work at abstracts at more than 25 abstracts at international scientific conferences, and we've had a number of high-impact publications from this in the Nature journals, the Lancet journals, and we've got a couple coming down the pipeline that I'm looking forward to telling you about soon. We've received more than 13 million in grant support, either directly or indirectly related to this work, including funding from HDR UK and from NIHR and others. And perhaps most importantly, we have now built the infrastructure at Moorfields to begin to be able to aggregate and curate our data. And we now have the experience in doing an AI project with NHS clinical data that is at the forefront of this field. And that experience, I think, is going to be gold as we move forward. So let me sort of embody that in one of our studies that's come from this. So has come indirectly from the collaboration with DeepMind. They're not involved in this study. It's called the ALSI study. And the ALSI study takes the idea that, a sort of age-old idea, that you can look at the eye and derive insights about someone's systemic health. So that has been supercharged in recent years with deep learning, where we can now look at a retinal photograph, and a deep learning model can look at that photograph and say, this is a woman, she's 58 years old, she's a non-smoker, she's not a diabetic, her BMI is around 25, and her blood pressure is 150/85. Wow, that's pretty amazing. Now, what we're planning to do is to take that to the next level. Now, what we've done is we've taken all of the OCT scans and other ophthalmic images at Moorfields, more than 3 million scans, and we have linked them now with the NHS Digital Hospital Episode Statistic Database, the HES database. It took us 2 years to complete that process, and only because of the experience that we had gained from the DeepMind collaboration were we able to navigate that process. Now, the upshot of that is that we now know every patient at Moorfields who's had an eye scan done, who's gone on to develop a heart attack, or dementia, or a stroke, or a range of other conditions. And the numbers are huge. So we have 2 to 3 orders of magnitude more patients who've got this imaging, who've gone on to develop Alzheimer's, for example, than we have in UK Biobank. So huge amounts of data. Now this was funded by a grant from Fight for Sight and Alzheimer's Research UK for £15,000. So I call it biobank on a shoestring. Now the potential of this we think is huge, and in December in The Economist it was a nice article written about it in the Christmas issue. And then the person who wrote that article did this tweet. So this is a guy called Hal Hodson. He's a technology correspondent for The Economist. He's a well-known expert on data protection. And what he said is that I have never seen any team dot the I's and cross the T's like the team at Moorfields. And the potential is mind-blowing, but they're building it while respecting patient rights. That's the thing that I'm most proud of in this statement. So what we want to do now is take what we've done at Moorfields and share the learnings around the technical infrastructure that we've built, but perhaps more importantly, share what we've learned in terms of how to do patient public involvement and engagement and data protection and information governance. And before I get too cocky about what we've done, I should say that we're kind of learning by doing. So we're certainly always open to like iterating and getting better in terms of these aspects. And of course, what's exciting then is that we have got support here in the UK to do that ambitious task of sharing what we've learned with other centres and through funding for the Insight Health Data Research Hub, which Alistair is going to talk about shortly. So my last slide, where are we? Next steps. Well, we are continuing to work with the industry partner, which is Google, to think about how we can actually implement the algorithm that we described in Nature Medicine. And let me tell you, that is, even for a big company, that's a challenging task that takes quite a lot of time and effort to do. We're working with the Insight Hub to share what we've learned about aggregating and curating the data. We've also created an independent research program now at Moorfields where we're building links with academic AI collaborators at UCL and Cambridge and other world-leading centres so we can start to do lots of novel early-stage AI development within academia and within the NHS. And lastly, just to say, I think that despite all the hype that is out there, I do think that AI has the potential to transform healthcare. It's not magic, but there's many ways where it can be very powerful. And I'm proud that ophthalmology, I believe, is at the forefront of that transformation. And I think that we have an opportunity to, for Moorfields to lead this in terms of ophthalmology, for the NHS, and for the UK as a whole to be world leaders in this regard. Thank you very much.